All, this is Dr. Mobeen Sayed. Welcome to one more show. Today we are going to be a little more sharp. The reason for that is that after my previous 7 minutes Novavax video, I saw a lot of comments, some about the vaccine itself that I had discussed earlier, and some about the severe side effects, for example, anaphylaxis or thrombocytopenia. And there were some questions also about the vaccine itself and is there fetal cells involved or not. So I want to make sure that please, whoever is listening, listen to this whole broadcast. I'm going to try to keep it short, but still discuss the important points. So let's start from here. Number one, this vaccine does not have messenger RNA in it. Second, this vaccine does not have an adenovirus. That means it also does not have a DNA for the spike protein in it. Third, this vaccine is not built in any of the human fetal cell lines. It is actually built in moth cells. And I have done a complete discussion about that in one of the previous discussions. Number four, this vaccine, at least from the data that we will see today, does not show any increased propensity towards thrombocytopenia or towards anaphylaxis or towards myocarditis and pericarditis. And I had used a term that between the two groups, vaccine and the placebo, the occurrence of these issues was balanced. What that meant was that they were actually sort of equal, plus they were also equal to the normal occurrence in the community. This is the point of the placebo, that you see the placebo group and see if some things are occurring there and what is the count there. And if a similar count is occurring on the intervention side, then they are sort of similar. Then there was another comment about the relative risk reduction or efficacy. And once again, somebody said that some doctor has said that efficacy reduction is actually just 1%. I have done this discussion in detail in past video, relative risk reduction and absolute risk reduction. So please watch that. But the quick anecdote, at the risk of making you further confused, will be, if you're already confused about the risk reduction, is that if, let's say, the total risk, original total risk is 2%, and then after the intervention, new risk has dropped to 1%, then there is a 50% reduction. So that is how the efficacy is measured and discussed. And that is not a new theory. This is how these data have been discussed from ever. So with these, some of the points that make it, plus I want to say one more thing. It is a traditional vaccine. That means they take a part of the virus, the spike protein, and they put that together as a vaccine. So it doesn't have messenger RNA or DNA. So it is traditional. The adjuvant is traditional as well, matrix M. And so they feel that with this traditional vaccine, anyone who is concerned about messenger RNA or DNA will be less concerned. So with this, what I'm going to do today is to go deeper and actually review the severe side effects data with us. So you're not going to hear it from me. Instead, you're going to see it. Number one. Number two, I'll show you the link so that you can download that document by yourself and do a deeper digging as well. So let's start our discussion. And my apologies for the mouse clicks. So this is the preprint for Novavax. And if you see here, it was posted on October 10, 21. The data point that I've already discussed are here and in this PDF. But the one that I'm going to discuss today is this one. If you, let me see if I can make it a little bigger. If you see here, it says supplementary material. I am going to discuss the data in this PDF. So you can download it here as well. And you can also see this. And how do you reach here? You can just Google or DuckDuckGo for Novavax press releases. Go to their press release for October 11, and you can see this link to this PDF. In addition to that, Lynn, a cool bean here, reminded me that today, this is October 19th, they had a press release as well. This is a very good press release too. This is a phase 2 clinical study result, but this is really interesting. The result is, and Lynn, thank you very much for referring it. The result is Novavax given as a second dose after Pfizer or Moderna or AstraZeneca, and its efficacy. I love it because that means Novavax can start participating as the second dose candidate, even when people have taken the first dose of a different vaccine. So if you see here, the studies done by Oxford, the study showed that Novavax CoV 2373 remains well tolerated and generates a robust immune response when given as the second dose in a mixed or heterologous regime or regimen after either the Oxford, AstraZeneca, or Pfizer BioNTech. So sorry, I spoke Moderna, so that's not here. So that is a very good news. And let's just look at this one as well. Novavax was pleased to see an encouraging side effect profile in which a second dose of Novavax CoV 2373 was comparable to a homologous regimen of either the Pfizer BioNTech or Oxford AstraZeneca. This had no further severer side effects. And then here, what variant? This was another question yesterday, that did this include Delta? So no, this has not included Delta. This has, the test time was with the Alpha and Beta and other variants. Although because it is a spike protein from the original Wuhan, many of the candidates, even including Delta, will be taken care of by this. That is what I suspect, but we don't have data for that. Now, let's look at the data itself. So this is that PDF that you can download, which from the link I showed you. The PDF just starts in a very humble way here, supplementary appendix and done. This is the original one, and we went over this original yesterday, and some of you will remember I was trying to find where is the data, and it turned out it was in supplemental table. So today I just went over it. So I can't go over all the data, but I want to go over severe cases. So let's start. So first of all, this table. I think this is the most important table. So if you see this table, after this, I would go over one more or two more tables. But if you just wanted to see this table and break after that, that is fine too. So here, serious adverse effects of interest reported in PREVENT-19, including safety signals observed during use of other COVID-19 vaccines. Beautiful. What they're saying is, as the other vaccines are administered, we are observing that there are some issues like myocarditis or pericarditis or thrombocytopenia. So we wanted to observe our own vaccine in those contexts, and here is the data for that. So here, if you see, there are three main columns. One column is greater than 18 years of age, then 18 to 64, and then greater than 65. So let's look at this data together. Really important. Cardiac disorders. So we all have been talking about, will this vaccine have myocardial issues or so on? Myocardial infarction. Now keep in mind, please, the vaccinated group, intervention group, was double in size to the placebo group. So it is possible that you see the number 4 over here, for example, and that still comes to be 0.08% because this group was actually double. So here 4, and on the placebo side 2. This is what we mean by balanced. It was the same. So that means, again, this data is not all of it. We'll see when we go out in production, and we'll get more data as we're getting more data for other vaccines too. This is just in terms of the trial. What do they have here is what we are reviewing. I cannot predict the future. I hope future stays the same, but we'll see more as the days goes by and as it is approved. So 4 on the vaccine side and 2 on the placebo side, but because vaccine is double, the percentage is 0.8, 0.8, and 0.08 balanced occurrence. Balanced occurrence means now that possibly it's not contributed because of the vaccine. because placebo side had the same percentage of issue of this type. Myocarditis, this is important because we've seen myocarditis occurring with messenger RNAs in the youngsters. Myocarditis, again, age 18 and over, 1 and 1. So it is actually lesser than placebo side. So again, that doesn't mean that it reduces myocarditis. It's just that data is that way. And it is, of course, 30,000-ish people instead of millions. Pericarditis, another important one, 0 throughout. Look at this, 0 throughout. Respiratory, thoracic, and mediastinal disorders. Second one, pulmonary embolism, which is also another important thing to look at. 3 on the vaccine side, 2 on the placebo side. So vaccine side actually had lesser of embolism in the greater than 18. If you look at 18 to 64, 1 and 1. So again, I'll keep repeating, vaccine side is double. So 1 here means actually half of the placebo. So, and then greater than 65, 2 and 1. So 0.29 and 0.3, so almost equal. This is what we mean by balanced occurrence on both groups. So that means, should we be, at least from this data point of view, should we be concerned about any cardiac issues? No. Or any pulmonary issues? No. Then vascular disorders. So of course, we've been thinking about thrombocytopenia, embolism, deep vein thrombosis, and so on. So look at the vascular disorders. Deep vein thrombosis, 2 on the vaccine side and 0 on the placebo side. So here there is a signal. Is it significant? Don't know. We'll have to have more data, but at least from this data point of view, it is more than placebo. Embolism, 0. On the placebo side, 1. So again, in my opinion, this is just data size being small that we see these variations. 0 on the embolism side and placebo side, 1. Embolism 0 on the vaccination side and placebo is 1. If you see here, 18 to 64, 0 embolism on the vaccine side, 1 on the placebo side, and then 0 greater than 65. So really between 18 to 64, placebo side had an embolism. Cerebral venous sinus thrombosis. So remember strokes, that danger. So check this out, the whole line is 0. Again, the way, please, I hope I don't keep repeating and annoying you. Keep in mind that this data set is small. So as we get more data, these numbers might change, but the trends that you're seeing here are very encouraging compared to other vaccines. Blood and lymphatic system disorders. Thrombocytopenia, 1 on the vaccine side total and 0 on the placebo side. And this one was between 18 to 64. It was not in greater age. Disseminated intravascular coagulation, nothing. Neither placebo nor here. Guillain-Barré syndrome, nothing, 0. So these are, so you can actually break here because now this important data is done. This is that data which has surfaced as worrying because of the observation in other vaccines. So they said, here is the data from us. Now I'm going to continue. Some more data. Of course, these tables are very large tables. I cannot go over every single one of these, but I wanted to make sure that we see some. So this is another table, supplementary table 15, unsolicited serious adverse events by system, organ, class, and preferred term. Unsolicited. So people reported them. They said, hey, I got this. Adverse events by system. So let's see. And I have highlighted some of them. You can actually go over this and see all of them. But for example, cardiac disorders, atrial fibrillation, 7 on the vaccine side, 2 on the placebo side, 0.13% versus 0.08%. little above on the vaccine side. Myocardial infarction, equal on both sides. And you can actually look at all of the columns. I'm expecting that I can walk you through some parts of it, and then your curiosity can then be met with you doing a deeper dive by yourself as well. Acute myocardial infarction, 2 on the vaccine side and 2 on the placebo side. So placebo side is actually more. Myocarditis, one on the vaccine side, 1 on the placebo side. So in percentage, placebo is more. Nervous system disorders, cerebrovascular accidents or strokes. 7 on the vaccine side, 1 on the placebo side. There is a large difference here. They haven't explained it. I think that there may be questions about it. Ischemic stroke, 2 and 0. Now, these 7 cerebrovascular accidents, or CVAs as we call them, 5 of them occurred between 18 to 64, and 2 of them occurred after 65. Then neuropathy peripheral. And remember, we've been transverse myelitis and other such things. There is 1 case on the vaccine side and nothing on the placebo side. These are still not worrisome because the number is really small, and this could just be a coincidence. It could be because of the vaccine too, but with this data set, we are not yet clear. Generalized tonic-clonic seizures, 1 on the placebo side, nothing on the vaccine side. Syncope, that is people becoming passing out or becoming faint, nothing on the vaccine side, 2 syncopes on the placebo side. Again, to me, it seems like coincidental. Sometimes people do faint with the with the vaccine. So I do not know when did this syncope occur, right at the spot or later on. Pulmonary embolism, 3 on the vaccine side, 2 on the placebo side. From a percentage point of view, vaccine side had a lesser percentage compared to placebo. Remember, vaccine side was double in number. Vascular disorders, deep vein thrombosis. We've been thinking about it, right? So 2 on the vaccine side, 0 on the placebo side. So vaccine had 2 and 0 on the placebo side. Both of those deep vein thrombi that were 2 were in greater than 65 years of age. Embolism, if you see here, embolism was 1 on the placebo side, 0 on the vaccine side. I would consider that to be a coincidental, because you can't say that, well, placebo caused it. Abortion, spontaneous abortion, pregnancy, abortion spontaneous, 3 on the vaccine side, 1 on the placebo side. Again, vaccine side is double. The percentage is 0.06% versus 0.04%. Pregnancy as an event, 2 on the vaccine side. So 2 people who were vaccinated, 2 women who were vaccinated became pregnant. None on the placebo side. So again, this may be group size difference. Abortion. So again, it's not that the vaccine caused them to become pregnant. It's just that was a bigger group. But you can see that vaccine did not interfere with the pregnancy. Abortion, spontaneous, complete, 1 on the vaccine side and 0 on the other side. So here, there is a 0.06% abortion, spontaneous, and then complete 0.02% versus lesser on the placebo side. Blood and lymphatic system disorders. And I highlighted here thrombocytopenia, 1 on the vaccine side, nothing on the placebo side. And this one was between the age of 18 to 64, not greater. Then there is renal disease, endocrine, metabolism, and so on. So this is this data. I've already gone over this one. Now, one more table, and I'm mindful of it's 21 minutes. One more table, this one, some more data here. This table, this is the last one, and then I'll stop. This is the supplementary table number 14. The table is, the data is summary of unsolicited adverse events. Unsolicited, they didn't ask for it and people reported it, by system, organ, class, and preferred term reported after start of the first vaccination through 28 days after the second vaccination. So remember, in this one, there can be people who just got the first dose and not fully protected and not fully having the effect and still have these symptoms. So this is starting from the first dose, 28 days after the second dose. That is a time span. First dose, 21 days later, second dose, then 28 days more later. So about 2 months. Fatigue, if you see here, in the vaccinated, 196 people had fatigue. On the placebo side, 69%, 7.13 versus 69. So fatigue, myalgia, joint pains, they were of course more on the vaccine side. COVID-19 itself, and that is that data here, I could not really make sense of this part. Here is why. See, it says 49 on vaccinated side, 38 on the placebo side. But we looked at the data yesterday, which said 14 cases on vaccine side and 63 on the placebo side. So I am not clear for what does this 49 mean. And I have to do some more digging and find it. So this is a line I would leave with you as a thing to think more about, or maybe I did not catch it correctly. Maybe they had COVID before. So I have to talk to them. Musculoskeletal system, myalgias, kind of muscle pains, and 109 on the vaccine side, so 3.9 or about 4%, and 30 or 2% on the placebo side. So the vaccinated people after the shots experienced myalgia, which is expected. GIT disorders, diarrhea, nausea, vomiting. If you see here, 3% diarrhea, 4% on the placebo side. Nausea, 3% on the vaccine side, 2.8, almost 3% on the placebo side. So almost equal. Vomiting, 1.2% on the vaccine side, 0.8% on the placebo. So almost once again nearing. Rash. So some folks have that feeling that, hey, what would happen? Would I get that rash after the Moderna has been known for that rash? So 61 on the placebo side, 22 on the, 61 on the vaccine side, 22 on the placebo. So 2% versus 1.62%. Then lymphadenopathy, so swollen lymphs. And of course, after vaccine, the lymphs will swell up, or after infection, they would do that too. 53 on the vaccine side, 13 on the placebo side, 2% almost to 1%. Then here, reproductive system and breast disorders, 55 on the vaccinated side, 2%, versus 17 on the placebo side, 1.25%. So 0.75% more on the vaccine side. Again, is that significant? Will that happen as the numbers grow? We'll have to see. Cardiac disorders, 45 on the vaccine and 21 on the placebo, and almost similar in percentage, 1.64 versus 1.54. Ear and labyrinth disorders, for example, balance or tinnitus type things. Vaccine 44, placebo 16, 1.6% on the vaccine side, 1.18 on the placebo side. And then there are more, but this is it. This is the discussion. Correct, 0 fetal cells. So a quick announcements. Number 1, my arm is really hurting. I can't do a chit chat today. I want to go and sleep. Number 2, we have Dr. Chetty joining us tomorrow morning. So I believe it is 9 or 9:30 in the morning tomorrow, Pacific time. So please be aware, tomorrow we will not have a talk in the evening. We'll just have the morning talk. So that is number 2. Number 3, I hope this is useful for you. Please like, subscribe, and share. That is a free support you can do for me. And if you would like to support more, which unfortunately nowadays I have started needing it, but totally it's not a compulsion. If you would like to support it, there are links in the description. One is to buy me a coffee, one is to use PayPal to support, or to be a patron. Stay safe and happy. This is a good vaccine. I like this one. I hope it becomes approved soon. I hope we can get it and we go from there. So thank you very much, and I would see you tomorrow morning. Bye bye for now.